recall what shift you were working?
Shift 1 for us, which is a 24-hour shift.
And at approximately 7:35 p.m. were you directed to a particular location?
Yes.
Do you recall what that location was?
4 Warren Street in the town of Shirley.
And what is 4 Warren Street?
It's a private residence.
And what was the purpose of that ambulance run?
We respond as mutual aid, ALS, paramedic level to the town of Shirley for what was reported as a possible gunshot.
And what does ALS mean?
Advanced life support.
And did you in fact go to 4 Warren Street?
Yes.
And who was with you at that time?
At that time, my captain, Captain Paul Filmer.
And were you in the ambulance when you headed to 4 Warren Street?
Yes.
And you left from the Ayer Fire Department?
Correct.
And when you arrived at 4 Warren Street, did you meet with someone?
When we first arrived on scene, I was met by Al Deschler, EMT for the town of Shirley.
And did you speak with Al Deschler without going to upset?
Yes.
And as a result of that conversation, what did you do?
As a result of that conversation, I set up in the back of their ambulance. I set up my equipment in order to treat the patient that was reported to be coming to me.
What type of equipment did you set up?
We have what we call our first in bag. In that we carry IV equipment, intubation equipment, general trauma equipment. We also brought my cardiac monitor, and I carry a drug bag, medicine bag.
Sorry. Did you go into the residence at 4 Warren Street, or did you stay in the ambulance?
I made it up to the front door. I never actually entered the main residence.
And why didn't you enter the main residence?
It was believed to be a crime scene, and they were bringing the patient out to me. So in order not to contaminate the crime scene, we try to keep as many people outside. They had enough hands inside to deal with what they had in there. So we then went to their ambulance and set up.
And at some point, was an injured male brought to that ambulance?
Yes.
And that was the Shirley ambulance?
Correct.
And what were your initial observations of that male?
Initially, the first thing that I checked for is to make sure that he's awake and able to answer us. And he was. He was awake. His eyes were open. He was breathing.
And approximately what was his age?
In his 20s, early 20s.
Did he have blonde hair or short hair?
Compared to me? Longer hair.
Than yours.
Than mine.
And for the record, your hair is quite
very
close cut. Just taking a look around the courtroom, could you look around and see if there's anybody you recognize as the injured male who was brought to your ambulance on January 23rd, 2009?
Yes.
Okay. And could you point to that individual and identify him by a piece of clothing?
The gentleman with the blue shirt.
Your Honor, may the record,
All right.
Your Honor, may the record reflect identification.
Yes, it may.
And what did you do with regards to the defendant who was first brought to the ambulance?
According to our training, the first thing we want to do is make sure he has an open and patent airway, which means he's breathing adequately, able to respond to us. So we check the airway, we check the breathing, we check circulation, the vitals, and mental status.
And did you assess the defendant's vitals?
Yes.
Were his vitals normal?
Yes.
And what does that mean?
For an adult, a normal blood pressure is going to be between 110 to 140 systolic blood pressure. And that's, for most people, that's the top reading. And the diastolic is going to be, in general, between 60 and 90 for an adult male.
And was his blood pressure, in fact, in that range?
It was.
And what about, for instance, his pupils?
That is one of the things that we do check.
And was that also normal?
It was normal.
And what does normal mean with regards to pupils?
What we're checking for with pupils is to see if they're reactive to light, if they're sluggish, if they constrict quickly. These things lead us towards head injuries, drug use, their general perfusion, if they're able to maintain properly.
And you indicated that you also assessed the defendant's mental state, is that correct?
Correct.
Is that also called a neurological assessment?
Yes.
Okay. And what did you do in order to assess the defendant's mental state?
Pretty simply, we asked him questions that the average normal person would be able to answer and answer appropriately. The date, the day, month, president, their name, excuse me, certain questions like that, something that somebody would be able to answer normally.
Was the defendant able to tell you his name?
Yes.
Was he able to tell you his date of birth?
Yes.
Was he able to tell you his age?
Yes.
What about the date?
Yes.
Was he able to tell you whether he had any allergies?
Yes, he was.
And what was he allergic to?
Pineapples.
He was able to tell you that he's allergic to pineapples?
That's what he told me, yes.
And what would you say, based on your assessment, what were the results of the mental status assessment?
I found him to be of a normal mental status.
What does it mean to be oriented to time and place?
That's part of the general assessment. It means that he's perfusing well. It means he's probably without assessing his blood pressure, he's got a good blood pressure. For us, it means he's getting adequate oxygen and his brain is able to function properly.
Would you say that the defendant was oriented to time and place when you encountered him on January 23rd, 2010?
Yes.
And when you asked him questions, did he appear to understand them?
Yes.
So what you observed in terms of injuries, what injuries did you observe?
The first thing that I noticed is he had a contusion to his head. And the other significant injury that we noted was a laceration to his left wrist.
When you say contusion, what's a contusion?
A bruise with swelling.
And you said that he had a contusion to his head?
Correct.
Was it bleeding?
Not profusely bleeding. There was blood, dry blood from there.
And what about the wound to his left forearm? Was that bleeding?
As I recall, it was still oozing. It was not profusely bleeding.
And what did you do with regards to those injuries?
We bandaged.
And during the course of the physical assessment of the defendant, what, if anything, did you observe in his hands?
While I was assessing him, checking for other significant injuries, I found some hair that was in his left hand.
And what was the length of that hair?
It was long. It was longer than mine, of course, but it was longer.
Would you say, just looking at me, would you say it's longer or shorter than my hair?
I believe it was probably a little bit longer than yours.
The rest of my hair is about shoulder length, maybe a little bit shorter. Do you recall what the color of the hair was?
No, I don't. It was colored.
And how much hair was there?
Approximately, I would guess, 10 strands.
And what did you do with regards to that hair?
I removed the hair from the hand, I wrapped it up in my glove, and I called for one of the people around me to get a police officer.
At that point, was the ambulance still stationary?
Yes.
And did you, in fact, turn that hair over to a police officer?
I did.
Do you recall which police officer?
I do not know his name.
If I suggested it was George Victor?
Yes.
And did you transport the defendant somewhere in the ambulance?
Yes, ma'am.
And where did you transport him to?
From the scene, we went directly to Neshoba Hospital, Life Flight Landing Zone.
And about how long did that take?
I don't recall off the top of my head.
About how far?
It's approximately 8 miles. It probably took us under 5 minutes.
Okay, and during the course of your assessment of the defendant and that ambulance ride that you think took about 5 minutes, did you have a conversation with the defendant?
Yes.
Okay. And what, if anything, did he say relative to how he sustained his injuries?
He had told me that he had cut himself.
Okay, that's with regards to the cut on his arm?
Correct.
Did he say anything with regards to what he cut himself with?
A knife.
And did he say anything relative to having been in a fight?
He did.
And what did he say?
He had told me a bitch bit me. She bit me on the head.
And did he indicate that he in fact had been in some sort of fight?
Yes.
And when asked about what happened to the side of his forehead, what did he have to say about that?
He would not speak about that.
Did he indicate whether it hurt?
Yes.
And when he said it hurt, what was his tone of voice?
It was matter of fact. Just matter of fact. My head hurts.
And throughout the course of the conversations you had with the defendant, what was his demeanor like?
Almost, it was borderline on nonchalant, almost, objection, Your Honor. Nonchalant, borderline on almost disgust with the question. With the questioning, the whole line of question.
You indicated that the defendant answered a number of questions, such as his name, date of birth, how he sustained some of his injuries. Were there any questions that he did not answer?
Yes.
And what questions were those?
We asked what happened.
And what did he say with regards to what happened?
He just wouldn't answer.
You asked him that more than once?
Yes.
How many times did you ask him that?
Approximately 4 or 5 times through the entire time we were there.
And he never said anything in response to that question?
No. Other than that, no.
Do you recall whether at some point during the ambulance ride he was vomiting?
Yes.
And at what point in the ambulance ride was that?
It was towards the end, if I recall correctly. We were at the life flight landing zone, just about at the life flight landing zone.
And where were you in relation to him when he vomited?
I was down towards the feet.
From your position, were you able to smell whether there was any alcohol in his vomit?
No.
You weren't able to smell that based on where your position was?
I wasn't able to smell alcohol.
Okay.
I was able to smell vomit.
Okay. Based on your training and experience with regards to head injuries, is there any correlation between vomiting and head trauma?
There can be, yes.
And what type of correlation is that?
With head injuries, you could have some swelling to the brain, which can affect all sorts of body functions. And a lot of times with a closed head injury, significant closed head injury, vomiting is one sign that we'll look for just to lead us in the right direction in how we want to treat the patient.
At some point did you arrive at the med flight location?
Yes.
And how long total would you say you were with the defendant until you arrived at that med flight location?
Approximately 25 minutes.
And during that 25-minute time period, do you have any difficulty understanding the defendant when he spoke to you?
No.
Did he appear to have any difficulty understanding you when you asked him questions?
No.
Was he able to respond to those questions?
Yes.
And was his speech slurred?
Did not appear to be, no.
Did you notice whether his eyes were red or glassy?
They were not.
Did you smell alcohol in the defendant at any time?
No, I didn't.
And the inside of that ambulance is pretty close quarters, isn't it?
Yes.
About how big would you say the ambulance is?
It's approximately 5 foot wide by 8 foot long, under 6 feet tall.
And what did you do with regards to the defendant when you got to the med flight location?
We continue to assess the patient until the life flight crew gets on scene. We report off to them and then assist packaging the patient into the helicopter.
Did you have any conversation with life flight personnel?
Yes.
Did you give them an update as to the defendant's medical condition?
Yes.
Did you have any further contact with the defendant after transferring him to the life flight personnel?
No.
You want to manage that for a moment?
Yes.
Sir, what information did you pass on to the life flight personnel?
I informed them of the injuries that we had found, the vital signs that we assessed, and the treatment in which I rendered to the patient.
Did you have any conversation relative to what the defendant had told you? The conversation you had with the defendant?
I don't believe so.
Cross-examination. Thank you. Good morning, Mr. Swenson.
Good morning.
Mr. Swenson, my name is John Galvin. I represent Mr. Gulla. So you told us you've been an EMT for 8 years?
Paramedic for 8 years.
You've been a paramedic for 8 years?
Been an EMT for approximately 20 years.
You've been a firefighter for 8 years?
Correct. Actually, if I be correct, I've been a paramedic since 1999. I've been with the Ayer Fire Department for 8 years.
Okay. Now, on this evening, January 23rd, 2010, you got a call from your mutual aid to help the town of Sherwood, correct?
Correct.
And you keep a trip sheet.
Yes, sir.
And did you make out the trip sheet that night for your son? Hey, approach, Ron?
Yes.
I'm trying to show you Shirley trip sheet. Is your trip sheet somewhere down in the same?
No, sir. Yes.
And you have a trip sheet? Now, when you got the call, you arrived, you said, at the location, you were met by Al Dexler.
Correct.
And that's a paramedic for Shirley, correct?
Correct.
And you knew you had someone coming out with life-threatening injuries, correct?
Potential life-threatening injuries, yes.
He alerted you that he had called for a medical airplane to transport this patient?
I don't recall who called for it, but I do know that was called.
And you knew your job was to quickly get this person over to Neshoba so they could be transported on to UMass Medical for treatment.
Yes.
And that was your function, right? To check their vitals, keep them alive, and get them over there.
Yes.
And who are you going to meet over there at MedFlight? The medical doctor?
There, depending on which crew shows up, depending on which service is used, MedFlight flies with a nurse and a paramedic. Life Flight flies with a nurse and a doctor.
And on that night, was it a doctor and a nurse that showed up?
I believe so.
Now, when you brought, Mr. Gull was brought out to you, correct?
Correct.
Let me show you this report. You know, draw everything on the floor.
Yes, it is.
You had a chance to review
I believe so.
looked at it recently?
Last week.
Now, it's important you folks, you note the time a call comes in,
Yes.
you note the time you arrive on scene,
Yes.
and you also note the time you clear.
Correct.
And it's going to say the time you clear, that's the time at which the patient has left your physical custody and control. You turn them over either to the hospital or to the medical people.
It's noted what time we clear the scene, what time we get off to at the hospital, or in this case, the Life Flight landing zone. But that does not indicate what time the patient left me.
I'm sorry. You indicate what time you arrive on the scene.
Correct.
You indicate what time the patient gets off to the hospital. Correct?
Correct.
And you note the time they arrive at the hospital or the ambulance or the med flight?
Correct.
Would that be the time that says arrive? Or would that be the time that says clear?
I'd have to review. I'm not sure which one you're
May I
reviewing.
approach, Your Honor?
Yes.
Mr. Swenson, I'm asking you to look at the right part, the upper right corner as it faces the church. What's the first time it shows?
The first time that shows is call at 1925.
That'd be 7:25 p.m.?
Correct.
And can you tell us what's the next time?
That says arrived.
And what time was that?
1928. 1929.
So 7:29 p.m. You arrive at 4 Warren Street. Is that what that means?
Correct.
What's the next time?
1941.
What does that indicate?
That indicates the time we cleared the scene.
So that
En route, cleared 4 Warren Street en route to the landing zone.
And then what time is your destination?
1950.
1950. So that would be 10 of 8.
Correct.
So it's fair to say the entire time you were there was approximately 20 minutes, correct? Yet there was roughly 7:29.
Correct.
And you turned Mr. Gulla over to the doctor and the nurse by...
That is very close to the time because I don't believe the helicopter was on the ground, but it was landing, and then there's the time.
You sure they weren't already waiting for you?
I don't recall if they're already on the ground, but there's still the time for them to get from the helicopter to the ambulance.
Now, when you first got there, you said you had to wait a few minutes, correct?
Yes.
So when you got there at roughly 7:29, 7:30, Alex actually tells you what he has, and then he tells you they're going to be bringing him out.
Correct.
So you folks are waiting 2, 3, 4 minutes to bring him up?
Approximately 2 minutes.
2 or 3 minutes?
I guess.
And then they bring him into your ambulance, and you immediately take off, right?
No, sir.
Oh, you don't? Okay. But after you start doing some of your work, assessing him. Now, you indicated to me that you noticed first that he had a cut on his arm.
I didn't notice that first. I assessed his mental status and his vital signs first.
And you thought that he was orientated.
Yes, sir.
And Mr. Dutch was there at the same time as you?
Yes, he was.
You didn't find that he was confused in verbal response?
I didn't find that, no.
And you didn't go over Mr. Deschler's report with him at all?
No, sir.
He didn't go over yours?
Not that I'm aware of.
And allergies, you said that you found that he had pineapple as an allergy.
That's what he told me.
Mr. Deschler there when you were asking those questions?
I do not recall.
Now, what was the first injury you noted? You said you saw a lot of blood, a lot of dry blood.
The first injury that was noted was the injury to his head.
What part of his head?
His right frontal lobe.
Show us where that is. You noticed, was it all swollen out?
Wasn't extremely swollen, no.
It was swollen.
But there was some swelling.
And there was blood?
There was some blood, yes.
Fresh blood?
Yes, relatively fresh.
So you thought something had happened there, correct?
Correct.
But you were unable to determine what it was.
Correct.
So you only learned later on that he shot himself in the head.
Correct.
You didn't know that night.
No.
And then you noticed that he had cut on his arm?
Yes, he did.
And it was cut going up this way?
I know, sir.
No?
I don't believe so.
You don't?
I believe it was this way.
You think it was that way?
I believe so. I don't remember exactly what direction it was cut.
You don't make a sketch like the Shirley department does in the
Our run forms are computer generated. I don't have that ability.
Oh, they're all done by a computer. Did you notice lacerations on his right hand, on the back of his right hand?
I didn't notice any knife lacerations, no.
You notice multiple superficial lacerations.
There was blood on his hand, but there was no significant injury that I noted that could have been life-threatening.
And unlike Shirley, you don't have a form that lets you mark where the injuries are.
No, sir. The state is getting rid of those forms, and we've already updated to the computers.
So the computer doesn't give you that opportunity to respond.
No, sir.
And you didn't write any of those down. You could have written that down where the laceration on his wrist was, couldn't you?
I believe I did.
Did you write whether it was up or across?
I did not.
Did your report say that he's got some type of head injury here?
Yes, it does.
Now, what about the back of his head? Did you notice the injury at the back of his head?
We noted that the back of his head was squishy.
You noted that the back of his head was squishy.
Yes.
And you said we noted that. Was that you that noted that, or was that Mr. Dexter that noted that?
My captain actually alerted me to it. My captain was at his head.
What's your captain?
Paul Philibrown.
Paul Philibrown. So he noticed the back of his head was squishy?
Yes, sir.
And was that in your report? The back of his head was squishy?
I don't recall if it's in my report. I don't believe it's written in the report.
It's not in his report either?
In his report?
In your report?
In my report, I don't believe that's noted.
That'd be important to know, wouldn't it? That the back of his head was squishy?
There was no exit wounds. There was no active bleeding from the area.
His squishy back of his head, trauma patient, is kind of important to note it, isn't it?
Yes.
So you missed out.
No, sir.
Pardon?
No, sir.
Oh, you didn't note it, I'm sorry.
I didn't note it.
You didn't note it. And does your report go on to the doctor and the nurse on that flight?
Yes.
So they were not aware of that. You didn't note it.
I'm sure I verbally told them, but it's not noted in my report.
You also indicated that you thought he was orientated.
Yes, sir.
And you were asking him all these questions. You said 4 or 5 times you kept asking him what happened.
Yes, sir.
And that was during the course. How long was the ride itself? Is that a 10-minute ride? 5
The ride itself was approximately 5 to 10 minutes.
And during this time, he vomited.
Right, yes.
And were you trying to get an IV line in him?
It had already been established.
Okay, you put that in.
I did.
You put it in. Did Mr. Detchler try to put it in?
I don't recall.
You don't?
I established the line.
And you're also you're talking to him while you're trying to figure out what all his injuries are.
Correct.
And you felt he was orientated.
Yes.
The time and place.
Correct.
Now, you also, how many times did he vomit, you know?
One.
You vomited once?
That I recall. One.
You only recall one? And you said you were down by his feet?
Correct.
And you say, look, you rolled him over on his side so you could vomit on the floor?
Al and my partner rolled him. Yes.
You step back?
He was awake. I was attending to other things.
You were doing other things. What were you doing?
I was checking the monitor, rechecking his vital signs.
Okay, so you were monitoring him. You weren't dealing with him vomiting.
I wasn't actively rolling him so he could vomit.
So you weren't trying to see whether clear vomit or colored vomit, or whether or not you could determine and detect any odors from where you were focused on that and monitoring.
I was focused on the patient.
Pardon me?
I was focused on the patient.
That's correct. Now, you indicated that you collected ear strands.
Yes.
Did you collect the vomit?
No, sir.
The employee collected the vomit?
No, sir.
Hey, one moment, Ron.
Yes.
One for the Mrs. Swenson, if you know, do you know if anyone took any photographs of Mr. Gulla's injury?
Not that I'm aware of. Thank you.